Hi there, my name is Dr. Robert Kluss. I'm a dentist here at Laguna Spa Dentistry, and I'd like to talk to you about sleep apnea. Essentially, sleep apnea is when you're sleeping, when you wake up at night, maybe from a bad dream or something like that, you think, that's what caused me to wake up, but actually it could be that you've stopped breathing entirely and you're gasping for air. Sleep apnea is essentially what it is you're needing to breathe and you can't. And so you have what we call apnea, which is you're not breathing. Maybe 40% of the population has some form of sleep apnea or a sleep disorder. And the research shows that if you have maybe 40 to 50 times you stop breathing an hour, you're in a severe state of sleep apnea. A lot of people snore, and we find that out from a person's bed partner who might tell when they come into the office that, hey, my husband snores terribly, and this can be an early sign of sleep apnea. But just because you're snoring doesn't mean you have sleep apnea. The only way to determine sleep apnea is through a sleep study. Nowadays we have little monitors that we can put on your finger, or a little probe or a sensor that will determine if you're sleeping, and you do it at home in your own bed. And but then the results need to be analyzed by an actual medical doctor, and they determine whether you have sleep apnea or not. We make devices here in the office that address that. I use a particular device called a silent night, and it basically moves your jaw forward and allows your airway to stay open and prevents you from snoring, for one thing. That's why it's called a silent night. We know that snoring can be the first signs of apnea. And with the device in, it opens your airway so that you don't have that. And it can greatly reduce the amount of episodes that you have a night. If you're really severe and those devices don't work, then you have something called a CPAP. And I don't know if you're familiar with that, but it's a mask and hose that you have to wear connected to a device that forces air down your throat so that it keeps your airway open. When you have sleep apnea, one of the issues, medical issues can create is high blood pressure, heart problems, stroke. These are all symptoms that can greatly reduce your life expectancy. So if you have sleep apnea, when you treat it, now you've got the benefit of not having the episodes. You're getting your airway open. You probably lower your blood pressure and definitely prolong your life. You could go to our website and fill out a form that will determine if you're a candidate for further investigation. If this is something that you'd be interested in exploring here at the office, you give us a call. We can definitely set up a free consultation. Once you start using a device and you're actually not having those episodes at night, you'll find that maybe you're not as tired during the day. Some patients definitely feel rejuvenated and just have a better quality of life.